Caregiving is often described as a labor of love, but it can also take a toll on one's mental health. And while it can be a deeply rewarding experience, it's not without its challenges. Caregivers often face significant physical, emotional, social, and financial stressors that can impact their mental health and well being. The stressors, the emotional burdens, and constant demands of caregiving and the feelings of overwhelm, exhaustion, and burnout can lead to feelings of anxiety, depression, and other mental health conditions. And the mental health risks associated with chronic stress and emotional strain can, in turn, impact a caregiver's physical health by weakening their immune system, increasing their risk for chronic health conditions, and exacerbating existing health issues. Unfortunately, there's often a stigma surrounding mental health, not only in the general population, but in the caregiver community as well. And this stigma can prevent individuals from feeling safe in seeking help or speaking openly about their struggles. They may fear judgment or perceive asking for help as a sign of weakness. When I first started practicing medicine in the 1980s, I saw how hard it was for people to speak openly about their mental health and to ask for help. Since then, the stigma has certainly lessened, but is still present to some degree, and unfortunately, it causes many people to go without help because of their shame or concern about how other people might judge them. Has stigma kept you from getting help? In today's episode of the Caregiver's CarePort, we'll discuss how you can break through the stigma and activate supports and self-care and significantly improve your quality of life as a caregiver. Breaking through stigma takes courage. And to help you along, we providers work really hard to create an enlightened, supportive culture and safe places where we can talk about mental health and how people can get help when they need it. When you and I step out and normalize discussing mental health, our own openness can help stop the stigma and empower other caregivers to prioritize and safeguard their own mental health. Well, happily over the years, the public's perception of mental health struggles has begun shifting from judging mental health concerns as a sign of a character flaw or a weakness or something we just don't talk about. In large part, this has been because of two developments, I think. First of all, the increase of people's willingness to talk about their mental health difficulties and let people know how they've gotten help and coped. And then secondly, the advancement of neuroscience and a fuller understanding of the biological underpinnings of mental and emotional difficulties. We've just gotten more enlightened and smarter about it. Growing along with that advancement, there is a growing number of resources and increasing expertise available to help caregivers who want to better deal with their stress, grief, and loss, and illnesses such as depression and anxiety, or even for caregivers who just want to talk with people who truly understand what they are going through. Well, what are your options as a caregiver to find support for your mental health? Well, as it turns out, there are a variety of mental health resources available to support caregivers in their journey, from counseling services to your primary care provider to support groups to helplines. Let's talk about your options. The first one I want to start off with is your primary care provider. That's often a really good place to start. For one thing, they know you usually, and they They deal with mental health concerns quite a bit in their general practices. They're able to determine the types of problems you want help with, and then to kind of triage you to the services that they think might be the most beneficial for you. They're also able to tell if you need more intensive care for your mental health, and or maybe need therapy or medication might be in order to help you out, or whether you just need counseling or some additional support services. They're usually a good source for referrals to those options. So let's start off kind of with counseling services. Counseling services can provide an invaluable support for caregivers struggling with their mental health. Whether you're experiencing stress, anxiety, depression, or simply need someone to talk to, a trained counselor can often offer guidance and perspective. It can be a safe and confidential space to explore emotions, learn coping strategies, and develop a self-care plan. Many therapists offer virtual sessions online, and that makes it very convenient for caregivers to access support from the comfort of their own homes. Insurance plans will usually cover at least part of the expense of it. If finances are a concern and you feel like you can't afford counseling, I have one suggestion for you. Often the programs which train counselors are looking for people that their trainees can work with and can counsel as part of their requirements for getting their certifications and degrees. So oftentimes these programs will even offer free counseling or counseling on a sliding scale if your counselor is a trainee, and they will be getting good supervision from experienced counselors as they work with you. So you can look for those kind of programs through universities or perhaps through medical systems. Sometimes medical systems will also have a sliding scale to help make it more affordable. And then there are support groups. And support groups, when well run, provide a sense of community and understanding for caregivers facing similar challenges. And whether you are part of a group that is in person or meets online, they offer a platform for caregivers to share experiences and exchange resources and just offer each other mutual support. It's a way to connect with other caregivers who truly understand what you're going through. And you may feel like a weight has been lifted off your shoulders to realize that you're just not alone in your struggles. One piece of advice that I would offer regarding support groups is that when you begin attending a group for the first few times, do it as an experiment to see if the group is right for you. Notice how you feel after the group experience. Well-run groups will be uplifting, but I sometimes hear from caregivers that they tried a group but found it to be depressing because there was never movement from people sharing their negative emotions to true support and discussion of helpful ways to deal with their difficulties. That it just felt like a venting session, which in the end made them feel worse and more hopeless. So try out a group and know that some groups are very helpful and a great way to be able to connect and be understood. The goal is to feel better or to grow. So look for a group that is a good fit for you and a place where you feel safe and it's healing. Often organizations such as the Alzheimer's Association, churches, government organizations, and medical systems run groups for caregivers. The next one is very dear to my heart, and that is health coaching. And I really love health coaching. And after I retired from my psychiatry practice, I missed working with people. And I went through a period of time where I was recovering from breast cancer and back problems. And I tried health coaching. I was curious about what it was they did. And I found it to be incredibly helpful. So much so that I thought, I want to do that. And become a health coach. And I went back to school and did the training and got board certified in that. So what is a health coaching? A health coach, and how does it work? It's really a very empowering system of tools and techniques which help you develop your ability for self-management, mindset improvement, and problem solving. It's a relatively new and evolving profession. It's not coaching as you would think of coaching with a sports coach, where the coach is the expert who instructs the person and drills you on exactly what to do to be successful. In health coaching, you collaborate with your coach to clarify your own needs, set your own goals, and focus on your own preferences, needs, and values. And you learn to use your own personal strengths to grow and problem solve and to support your own health. You go through an active learning process of self-exploration where you're encouraged to problem solve rather than just be taught, the exact thing you need to do step by step. There is some learning of techniques and tools which the coach weaves into your sessions, helping you learn to make changes to support your health and well-being. And as you learn how to use those tools, you can apply them in many areas of your life. The coaching process builds motivation and confidence, and it helps you help yourself, and it strives to help you find your own answers and focuses on what is working well. It helps you identify what's right and go that direction as opposed to what's wrong. When clients are struggling to apply perspective or stuck in catastrophizing, a health coach serves as a guide to help you ground your perspective in reality and facilitate a healthy lifestyle that supports emotional well-being. They do not establish a diagnosis and treat just the diagnosis. The health coach really works to support a change process so that you start to think differently, reason differently, and commit yourself to healthy behaviors. Just even simple things like taking a regular walk, going to sleep earlier, eating well, hydrating more consistently. It can be simple things like that to more complicated things. You can find board-certified coaches through the National Board for Health and Wellness Coaching and by online searches for health coaches who specialize in helping caregivers. You can also find help through some religious organizations. Some religious organizations offer counseling for their members, and they may offer support groups which are usually open to anyone and are free or of low cost to cover materials and other resources. Even if your religious group does not have designated resources for caregivers, their larger religious affiliated organization may. Now, where do you go if you need help right now? Well, there are helplines and hotlines. Helplines and hotlines offer immediate support for caregivers in crisis or in need of urgent assistance. Whether you're experiencing a mental health crisis or simply need someone to talk to, trained professionals are available to provide support and guidance. The person on the other end of the line is trained to listen without judgment and offer practical advice for managing your stress. You can still call 911 if you're experiencing a crisis and need immediate assistance from emergency medical transport service or the police. But now we have the 988 Lifeline, which was established to improve both the accessibility of mental health crisis services and just the amount of focused mental health services available, in a relative crisis. The 988 helpline provides easier access through a network of over 200 crisis call, text, and chat centers, separate from the public safety purposes of 911, where the focus is on dispatching emergency medical services or police as needed. 988 is the 3-digit nationwide phone number to connect directly to the 988 Suicide and Crisis Lifeline, which was formerly known as the National Suicide and Prevention Lifeline. But you might be thinking, well, I don't have problems that are that serious. Well, the 988 number is not just for suicidal thoughts. A mental health crisis is really any situation in which a person's actions or feelings or behaviors can lead to them hurting themselves or another person, or it may be putting them at risk of being unable to just function in the community in a healthy manner. Some examples, in addition to thoughts of suicide for the 988 number, are just feeling overwhelmed with anxiety, feeling depressed, drinking too much or drug use, mental and physical illness, loneliness, trauma, relationship problems, and financial worries. So just remember, the 988 number is always available to you. It's available in 50 states and I think 8 territories in the United States, and other countries may have that kind of number also. Then let's talk about respite care services, because do you ever just feel like you need time away to regroup and rest or just have a change of pace? Well, respite care services offer caregivers a break from their caregiving responsibilities, allowing them to recharge and prioritize their own well-being for a time. Whether for a few hours or a few days, they can provide temporary relief while ensuring the care recipient's needs are met. So, how do you access those, and what are these resources? Well, you can research respite care resources available in your local areas, such as at community centers, senior care facilities, and home health agencies that offer respite care services. And online directories can also be helpful for that. Also, you can ask other caregivers you know about services they have used. Nonprofit organizations are also a really rich source of information, and some, such as the Alzheimer's Association, Parkinson's Foundation, and Muscular Dystrophy Association, offer respite care programs and services for individuals with specific medical conditions or disabilities. There are online websites and apps that connect caregivers with qualified respite care providers, and you can browse profiles, read reviews, and schedule care sessions based on your loved one's needs and preferences. You can find those by searching respite caregivers in your area. Online searches for caregiver assistance in state government websites are usually a source of great information and resources in your state as well. So caregiver support organizations also have resources and information about the respite care services in your community. And you can reach out to those organizations for guidance and about any financial assistance or subsidies that may be available to you. Healthcare providers such as doctors, nurses, and social workers can often provide referrals to respite care providers and guidance on the type of respite care that may be most suitable for your needs and your care recipient's condition and needs. I would encourage you to explore your funding options. Respite care services may be covered by insurance, Medicaid, or other government programs. Some respite care programs offer sliding scale fees or may provide grants to help offset the cost of care. And then reach out to family members, friends, and neighbors. They may have some ability to help you out with some respite time. To provide supervised and social activities for older adults and individuals, there are actually some day programs that are available in communities. You can enroll your loved one for a few hours or a full day, allowing you to take a break and attend to personal needs or responsibilities. If you are a veteran, there are veterans benefits for respite. In the United States, veterans and their caregivers may be eligible for respite care benefits through the Department of Veteran Affairs. The VA offers various programs and services to support veterans and their caregivers, and these include respite care vouchers, in-home services, and short-term stays in VA facilities. Now, before accessing respite care services, you may want to arrange for an assessment of your care partner's needs. This can help determine the level of care required and the type of respite care that would be most appropriate. Healthcare professionals or social workers can assist you with this process. And oftentimes, respite providers or agencies that provide respite care will do their own assessment prior to starting respite services. You just have to talk with them individually and see what their process is. Well, what mental health resources have you found helpful? I would love to hear what has worked for you. And if you have additional types of resources to add to this list, I would love to hear about them. Shoot me an email at cba@scissortailhealthcoaching.com. That's cba@scissortailhealthcoaching.com. And I'll share your feedback on the podcast. And I really appreciate it because it helps me to make the podcast as helpful as I can. And your feedback helps inform and enhance my own health coaching practice. In closing, I want to say that your mental health matters. Taking care of yourself is crucial, not only for your own quality of life, but also for the benefit of your loved one. Don't let stigma about mental health or feelings of shame or embarrassment from getting you any support, help, or treatment that you need. You are at risk. You matter. Your health matters, and you are worthy of care and respect. This podcast is brought to you by Scissortail Health Coaching, providing the highest level of coaching and support for caregiver health. I'm Dr. Corabelle Arps. I care about you. I care for you, and I'm rooting for you. Until next week, take care.